This is where you generally click if you want to write a prescription that day for the patient. If you want to do that, you will click the Add button and click the drug list button, and this is where you'll type in the actual name of the medicine. I'll go ahead and type in amoxicillin, and it will give me a list of all the amoxicillins that are in the computer. Now, you can usually just disregard this package size because the package size information doesn't actually show up on the prescription, and so if you're going to be prescribing a 150 milliliter bottle and you only find the 100 milliliter bottle, that's no big deal. You can go ahead and just select it. The only time I ever really look at the package size and the package description is when I'm trying to figure out if I'm prescribing, say, a cream versus a lotion of some sort of topical thing. It's helpful to look because a cream package size will be listed in grams, whereas a lotion package size will be listed in milliliters and so on. If there is no milliliters or anything like that, then it's likely to be just like a tablet or something. Like here where it says each. So let's select the 500 milligram tablets, and you'll see that now is entered in the drug name and strength. You can type your instructions either here in the instruction/sig field, or you can type it in the additional instructions. If it's going to be short, I usually just type it in the first one, the instruction/sig. If it's going to be long, I'd probably type it in the additional instructions field, because long values are likely to get truncated if you type them in the instruction/sig box. Now, if you don't want to type, you can bring up this drop-down list and see if you can find what you're looking for there, but I have never found that to be useful since the list is so long. So we'll type in 1 3 times a day times 10 days here, and here in this box you'll type in how many you want to give. So we'll type in 30, and obviously you can type in select how many refills you want to give, and this auto expire button is pretty important also. You'd like to go ahead, if it's a medicine that's only going to be given for a temporary period of time, you'd like to go ahead and select the amount of time that you expect the patient to be taking this drug, so that after that number of days the drug will no longer show up in their medication list. You don't want some amoxil that you prescribed or somebody prescribed 2 years ago to continue to show up in their drug list and cause it to be overly bloated and hard for you to figure out what they're actually taking and not taking. So do yourself and everybody else a favor, and if it's not a maintenance medication that they're going to be on, indefinitely, set an auto expire date when you prescribe a medicine. You can also select a diagnosis for that medicine if you want to associate it. That's a new feature that not many folks are in the habit of doing, and to be honest, I'm not sure exactly what purpose it serves. That actually is really all that useful. You can add a note to the pharmacy if you want, and that's pretty much it. There's an ingredient list. If you select some sort of medicine that, say, it's like a cough medicine and you want to see exactly what's in it, you can click this ingredient list, and for some things, if it's in the database, it'll bring up a list of the actual ingredients that are in the medicine. Here it just says amoxil or amoxicillin. I'm not sure why it shows several different ones, but formulary check, I don't know what that does. I've never used it. Common list, I've never used. Calculator is helpful. It'll bring up the Windows calculator so that in case you need to calculate a dosage, especially for a child. Note also at the top here that it gives the patient's age and weight, which is mostly important for children. If you're getting ready to type in or calculate the dose of a medicine for a child, it's helpful to have the weight in kilograms right there handy. So when you're done, you can click save, and now that prescription should show up as new in the patient's list. This is giving me a warning that the patient is sensitive to amoxicillin. I found that the computer sometimes warns that the patient is allergic to something even if that's not in their allergy list, and I don't know if that's a bug with the system, but we'll go ahead and continue anyways, just so you can see what it looks like when it shows up. And there you can see it was prescribed today, so it's in green. Stuff that's been prescribed in the past is in black, and then stuff that's in blue is stuff that was either entered as being something that was an over-the-counter medicine or something that was prescribed by another physician. And I forgot to show you, but that button is right here. And so there's prescribed in office and previously prescribed by other provider / OTC. And so if you're just entering the meds that a patient is taking that another doc's given them, you want to select this button here when you're entering it in, but so that it doesn't look like you prescribed that new that day. So we've got this patient's list of medicines here, and let's say today we're going to go ahead and tell them to stop taking the metoprolol because they're getting some orthostatic hypotension. And so what we'll do is we'll highlight that and we'll click Stop Meds. We'll select a reason, and in this case we'll select side effects, and we'll click OK. Before I click OK, I want you to notice that there's a date here, and it's something that you can modify, and that'll become important in a second. So I click OK, and it disappears. Now, when I do that, if I click on the document button, well, we haven't created a patient visit yet. Let's just kind of go into one of the trees just so that it thinks we're getting ready to create a visit. In fact, now that we've sort of started the thing generating a note, you can see it's got the medications history and it shows anything that's in there. And actually what I've done is so far not showing up. Let me click on plan. I'll just enter a dummy plan, refresh the document. Now you can see that once a plan is entered, it starts to generate the part of the note that includes the plan, and it's noticing that you stopped the metoprolol, and so to include that in the note, which is helpful because I'm of the belief that if the computer puts something in there in the note for you, you don't need to repeat it when you're typing in your plan in your note. It's just, it wastes effort, and it defeats the purpose of having the computer enter things automatically. So you can see that just the generic stuff that I typed in shows up, but by doing that, by typing in a plan, it also told the computer to start looking throughout the rest of the stuff I've done today and add any of that stuff to the plan, which is stopping that medicine. Now, let's go back to the RX writer, and I want to show you one other thing about stopping meds. Let's say that the patient comes in, and I'm just trying to, and I'm doing a visit for the patient that day, and I want to generate a note, but while I'm in there, I'm sick of looking at several medicines that the patient's not taking anymore, and I want to clean up their prescription list. Well, let's say that it has been a year since they took this last prescription of amoxicillin, and I'm tired of it showing up because the person who prescribed it didn't do what they were supposed to do and put in an auto expire date. Now I could just click Stop Meds and click Supply Exhausted and click OK, and that would be seemingly correct. But what's going to happen if I do that is it's going to show in my note that I stopped amoxicillin today, and then especially since I just prescribed some amoxicillin, that's going to look stupid. And so the point I'm trying to make here is that you can clean up a patient's medication list on the day that you're actually seeing the patient and prevent the things that you stopped from showing up in the note. And here's how: you select the thing, the medicine. You select your reason, whatever it is, and you want to click on that calendar and go by and just select any date that is prior to today. Now, I don't know how important it is to select the actual date or something that it is in the range of the time when they probably actually stopped taking it. If you want, you can just select yesterday and click OK. But I'm just kind of in the habit of trying to guess when they actually maybe stopped taking the medicine. So they gave them a week or 10 days of amoxicillin back in January of 07, so I just click and go back to 07 and maybe select the 15th of January, and I click OK, and then I click OK again, and now it's gone. I refresh my document, and I don't know why it's not refreshing, but you can see that it's still just showing that I stopped metoprolol. It's not showing that I stopped any amoxicillin today, and so that's kind of a useful thing also. So we've talked about how to add a medicine, how to stop a medicine, how to stop it and have it not shown in your note. What else do we need to do? Well, let's say we want to refill a medicine. Let's say they need to have their dexedrine refilled today. You select the medicine and you click refill. It automatically stops the old prescription and starts the new one as part of the refill. It shouldn't stop you here to make you click OK, but with refill selected, but it does, and it brings it up, and so it gives you a chance here to make any changes before you actually refill it. Let's say we're not going to make any changes, and we're just going to refill it the same way that it was, and so we save it. And again, I don't know why it's telling me they're allergic, but we'll just click OK for our purposes. And you can see it's in green now, showing that it's been refilled today. Now let's say that I want to